Genetic Disorders by Kayla Kepner.
Zachariah Payol.
Emily Heddo.
Klinefelter syndrome. What is it? It only occurs in men. They have an extra X chromosome instead of the normal XY. This syndrome can affect stages of physical, language, and social development. What causes it? Contrary to popular thought, it's not a gene mutation. This syndrome is caused by disjunction in the process of meiosis. Odds and signs. The odds of getting Klinefelter syndrome is 1 in 500 to 1,000. It is a rare syndrome to appear in males, and many live their lives without realizing they have the extra sex chromosome. There are many symptoms of the syndrome: small testes, less testosterone levels, breast enlargement, reduced facial and body hair, infertility, undescended testes, the opening of the urethra on the underside of the penis, longer legs and arms, tendency to be quiet, sensitive, and unassertive. Prognosis and how it affects life. Klinefelter syndrome can cause issues in learning and social and physical development. The syndrome is related to issues involving poor body image, learning disabilities, and others. That is why, when first diagnosed, it is recommended to see a mental health specialist. What is the prognosis? At the moment, there is no known prognosis on why this happens during meiosis. Tests and treatments. What tests can be taken to diagnose this? There are not many tests that can be taken to diagnose the syndrome, but the main one is karyotyping. Karyotyping is a test to detect any chromosomal abnormalities. What are the treatments? There are no true treatments for the syndrome. There are a few options that can help: testosterone replacement therapy, breast tissue removal, speech and physical therapy, fertility treatment, and psychological counseling.
Hemophilia. Description. Hemophilia is a disorder where the blood does not clot normally, causing large blood loss from slight bruising or injury. The amount of people affected by hemophilia are 400 babies per year, resulting in 4,000 people worldwide with hemophilia. Cause. Hemophilia has an X-linked recessive pattern, meaning only the X chromosomes can be affected. Hemophilia is a mutation in the genes. Factor VIII for hemophilia A for low clotting material, and factor 11 for hemophilia B gene mutation. Signs. Ethnic groups and gender. No ethnic groups are more attacked by hemophilia. Females are more susceptible due to having 2 X chromosomes. Signs and symptoms. Large and deep bruises, joint pain, swelling in the hips, unexplained bleeding, and prolonged periods. Treatment. Test. Blood samples to measure clotting material and plasma. There is no ultimate treatment, but injections of factor VIII and factor 11 are available. Prognosis. Hemophilia was passed on by Queen Victoria in 1837 by incest in the royal family, passing the infected genes to ruling families in Russia, Spain, and Germany.
Color blindness. Color blindness is an abnormal condition characterized by the inability to clearly distinguish different colors of the spectrum. Color blindness is caused by an infected X chromosome trait that causes your cone cells, which are the cells that cause you to see color, to not be able to either see or not be able to see color well. Males are more likely to get color blindness because if an X on a female is affected, but the other X isn't the one that isn't affected, it is enough to compensate for color blindness. The rate of men with color blindness is higher in males, 8%, than females, 0.5%, because males only have 1 X. The first known case of color blindness was when a man named John Dalton bought his mom's scarlet underwear. Signs of color blindness. They can't distinguish between red and green, low attention span, sensitivity to light, reading issues, headaches, excellent night vision, increased sense of smell, denial of color issues. Test. 100 test, the Farnsworth D15 test, and the Ishihara color vision test. As of right now, there are no treatment options, but tests are being made to see if an injection to the center of the eye will cure it.